Hi everyone, my name is Lakshmi Nakka, and today I'm going to be talking about disability discrimination in healthcare and how this relates to some of our biggest global health issues today. Here's just a little bit about me. I'm a rising junior at Dublin High School, and I'm the founder of the Anatomy of Experience Journal, where I talk about public health inequities by sharing the stories of minorities that have faced discrimination in health systems before. I'm also researching biorobotics and assistive technology at San Jose State University. I'm a part of my school's HOSA chapter, and I'm working with children who have special needs. My current interests are in bioinformatics, global health, and anthropology. So here's just a little bit of background on today's topics. We are going to be talking about disabilities, and a disability is basically a long-term sensory, visual, auditory, mental, or physical impairment that impacts someone's daily life. Disabilities can change how someone performs a daily task and communicates, and around the world, there are more than 1.3 billion people with a disability. And now, to kind of put this in a global health perspective, people with disabilities are 2 times more likely to develop diseases that are currently major global health concerns, including but not limited to diabetes, asthma, depression, and obesity. And this is mainly due to the large amounts of medical inequities that impact people with disabilities. Learning about these inequities, why they exist, and how they impact healthcare is so important to uncovering the solutions to prevent global health issues from impacting people with disabilities more frequently, and is important to preserving global health for everyone. Now I'm going to be talking about something called the medical model of disability. In the medical field, there is a certain way to look at and treat disabilities, and it is called the medical model of disability. This is basically an instruction to physicians to look at disabilities as something negative and to focus only on curing the disability. The implementation of this model has caused healthcare professionals to define someone only by their disability and to ignore other factors of their life, which causes a lot of problems in healthcare. I'd like to encourage you to follow the social model, which was made to combat the inaccurate and discriminatory medical model. It states that people with disabilities need to be supported in society, and to do this, we've made changes and try to fix society instead of trying to fix a person with a disability. Now, despite the social model having more significance in society today, the medical model still persists in medicine and has adverse effects on healthcare. Some of these effects are that people with certain disabilities are thrown into these large generalized groups based on their symptoms, and this doesn't work because disability manifests itself very uniquely and differently from person to person, and putting people in generalized groups based on XYZ symptoms can make it very hard to give these patients the unique and individualized medical help that they need. Additionally, this idea of the medical model of disability can cause the negligence of other existing illnesses. Take, for example, the story of a 60-year-old man from Dallas. He'd been suffering from mental illness for a long time and was living in an assisted care facility surrounded by medical professionals. And one of the health issues he actually had was cancer. He had a liaison on his nose since 2017, and despite him and his family visiting many doctors, none of them ended up performing a biopsy or the proper tests. He ended up receiving his cancer diagnosis last year in 2023 and passed away a few months later because he wasn't able to receive his treatment and diagnosis in time. This is not the only story of its kind. Things like this happen to people with disabilities almost on a daily basis. And if we can't combat this inaccurate view, serious ailments like HIV, cancer, and hepatitis may remain undiagnosed for long periods of time, causing them to be unable to receive treatment. And it opens up the possibilities of transmitting these ailments to others, which can cause greater global and public health issues. Now I'm going to talk a little bit about the systemic inequalities that make healthcare difficult for people with disabilities to access. One is the poverty and exclusion from education and employment. Because people with disabilities are often unlawfully turned down from education and employment opportunities, they often work in low-paying jobs that cannot sustain their lifestyle, or if they can't work, have to depend upon government-issued pensions. 80% of all people with disabilities live in poverty or are financially struggling because of this. And this makes it very, very difficult to afford healthcare, proper insurance, assistive aids and technologies. And this bars people from seeking professional health care because they can't afford it. And it again leaves them in this cycle of not being diagnosed early enough and then having to live with an ailment that they don't know that they have. Another is the discrimination and barriers that are already set up in healthcare systems. 4 in 10 adults with disabilities experience negative and unfair treatment in healthcare settings. And this is because of a variety of different factors. One is that many health systems are very inflexible about their policies, and a lot of these policies are very inaccessible, like having to sign medical forms independently, for example. And when they're unwilling to change and they're so rigid about their policies, it can make it very difficult for people with disabilities to navigate the system. Some medical systems actually even refuse to provide care for people with disabilities that can't walk and talk. And these systems also deny transplants, withhold medical treatments. And speaking of accessibility, most hospitals lack proper accessible equipment and pathways. All of these barriers make receiving care unattainable, inaccessible, and uncomfortable for people with disabilities. These factors prevent early diagnosis of serious health issues and is the reason why people with disabilities have a statistically greater chance of contracting a serious illness. Healthcare systems need to be made accessible and inclusive, and this can be achieved in a lot of ways, like including disability training curriculums for medical professionals, advocating for greater accessibility, and including people with disability in the process of building health systems and policymaking. And since I am talking to future health professionals, I'd like you all to step up and advocate for systemic change, because by ignoring the needs of people with disabilities, we put their health at risk, we put our own health at risk, and we put community health at risk, and this can cause big global health issues. It's time to be inclusive of everyone because healthcare impacts us all. Here's my references, and I'd like to acknowledge everyone with a disability and all the physicians and medical professionals that are taking time to advocate for disabilities, because it's the only way we can expect change. Thank you for listening to my presentation, and here's how you can contact me. I hope you learned something new, and I hope that you will take some time to advocate for your peers and community with disabilities. Thank you for listening.